As we continue to seek high reliability at MedStar Health, our journey requires us to embrace teamwork and collaboration. Safety huddles allow team members to communicate and share any safety concerns on shift changes and handoffs. The following is an example of one of the many safety huddles occurring at MedStar Health.
Okay guys, morning huddle. Good morning.
Good morning.
So as a part of the huddle, we have some safety moments. Anybody has a safety moment? Safety moment? Yes?
I just want everyone to be mindful that when they open these big containers, that they snap the container until it snaps or it can leak out. Like for instance, what happened here, and we don't want that to happen, so everybody be careful when opening these. Make sure they're closed tightly.
That's a good safety moment. What else is a safety moment? Erica, you have one?
Yeah. We want everyone, when you're doing floor stock, please pay attention to the codes, the numbers. They tell you where the tubing goes. Because when you don't pay attention, they get confused, and it could affect when we're doing IVs, especially with chemos or anything. Patients waiting on them, but we don't have the right tubing, and then we have to hunt around to find where the right tubing is. And if you don't know, you can just ask someone, and anyone in the IV room can tell you where the tubing goes.
So this is an excellent point though, because it's not just a matter of look-alike, sound-alike drugs, it's tubing, and you might think it's trivial, but you got to make sure you have the right tubing, because if it's not, then you need to come back, get the right tubing, and it can delay the process. All right. Yeah.
Piggyback on that. Erica, can you show them, like show and tell, where they can find the numbers on the bags? Because they're a little bit hidden, so just so that everyone knows if you're floor stock, where to look for.
Top left-hand corner under list number.
Right, and those should
And
match.
the list number is
right.
matching the bin. The list number is on the bin of which one goes in which bin.
So that's a good point. Just not look at the tubing, but look at the number and separate it out by the number. That's a good point. So as an ongoing now, we've covered the safety moments. What do we do to be survey ready? You know, we had the Joint Commission survey, we had the environment of care. So what things do you look for as far as medication storage is concerned when you're on the floor looking at the Pyxis machines and the nursing station areas? Yeah, Valerie?
Checking the temperatures with the slip, the temperature sheet
Yeah.
with the temperature, and making sure that they're accurate, and making sure the units are clean and not cluttered. Expired medications, making sure there's no expired medications on the nursing units, and everything is in the proper place.
Right. Excellent. So we do say survey ready, but you know, we don't do things because of the survey. We do things because that's the right thing to do for the patient. So it's just a check for us to make sure that we are doing the right thing. Anything operational, Sam?
Operational, we just want to make sure that everybody is alerted to the fact that insulin 7030 is not a floor stock item. We have to send it patient specific with the patient's label in a plastic bag, and then it's placed in the patient's refrigerator in the patient's bin, and it's used for that patient only. And then after the patient is discharged, it needs to come back to the pharmacy. So make sure that Novolin 7030 is not, Novolog 7030 is not a unit item. It should not be stocked with the other insulins.
Right. So they're not a part of the floor stock. We don't want to add another vial of insulin for the nurses to have to sort through when they're giving the insulin. Is there anything else? Renee, do you have anything?
No.
That's about it.
Yeah.
All right. Anything else that we need to discuss until Monday morning? All right. Thank you very much. Keep our eyes on. Have a good day. Have a good weekend.
Thank you.
Take care.